bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
One of the major issues we've been talking about healthcare-wise in our great state is the polarization between New York and Philadelphia. How to make sure that right here in our backyard, we have the best. Well, how are we doing in that category? Hello, everyone. I'm Joe Basikia. This is Comcast Newsmakers. We have the doctor with us. He's a New Jersey Assemblyman, Dr. Herb Conaway. He is the chair of Health and Senior Services in the State Assembly. He's a good guy to talk to when it comes to our hospital systems. Good to see you.
Well, nice to be seen. How are you?
It's so important to have you here with this very issue because we don't have to want to go to Philly or to New York. We want it right here. But right now, there's a lot of struggles in our state financially. Is it hurting the hospitals as well?
Well, hospitals are certainly affected by some very tough times. And there are a number of forces that are impacting hospitals that are important. You have the federal government, which seems with every budget, they're cutting back on payments to hospitals. You have insurance companies that negotiate very tough contracts that sort of bring down the revenues that go in the hospitals. And we in New Jersey, because we're a gateway state, have a number of people who are undocumented who go to the hospitals for their care. There are tremendous costs there. And we have a high number of people who are uninsured here in the state, also very often getting free or under-reimbursed care. All of those put great strain on our hospital system, and which has a number of structural issues that make it difficult for many hospitals to be profitable.
Let's talk perception, and this came up to a degree when we were talking about malpractice insurance a couple of years back. Many folks are paying through the nose to their doctors. And I don't mean to say that as a doctor here, but you know what the perception is. That's not always the truth. We think that those hospitals must be making money hand over fist. It's not happening.
Most of our hospitals operate in the red. And indeed, the state just received a hospital rationalization report which looked at the health of our hospitals. And the statistics, the findings there are very concerning to those of us who are concerned about the care that people need to receive in hospitals from time to time. Far too many hospitals operate in the red. Far too many hospitals have debt that cannot be adequately covered by the revenue that they have. We have hospital beds which are underutilized. We have a lot of hospital beds in places where there aren't patients. And taxpayers support a lot of the operations of hospitals. There are questions about oversight, the kind of care that's delivered there. When a hospital goes under or has problems, we know that it has a large impact on the communities. Jobs, not only in the hospital, but jobs that deliver services in and around the hospital, depend on the hospital to run their dry cleaner, to run their sandwich shop, to run the little ancillary services that go on around hospitals. So the hospitals in many cases are the lifeblood of the community where they are, many times in depressed communities where there's not a lot of other things going on. So there's quite naturally a lot of concern about what happens to the hospital on the economic side, and that's separate from what is there on the health side. What do we need to do? We need, I think, I know, to have a different system for identifying hospitals in trouble and for holding them accountable for the, in some cases, millions of tax dollars, tens of millions in some cases, tax dollars that hospitals get to make sure that they're taking care adequately of those without insurance, that they're delivering that care in the most efficient way, that hospital governance. I mean, some of the hospitals are in trouble because they've had bad decision-making on the part of their leadership. Well, how do we prevent that? How do we raise standards there? How do we prevent hospitals?
And how should we, the public, have to feel, we feel bad that we're thinking about bad leadership on their part. Now we got to pay them out of it because of our property tax scheme.
That's an issue.
The reality is we had to pay. If this was a patient, the hospitals, okay, you're a doctor. If they're a patient, what kind of condition are they in right now?
Well, they're certainly in, let's see, they're not in intensive care, but they're in what I'd call it step-down care. They are certainly going to be under an increased level of care in the hospital. In the hospital, hospitals are ailing, partly because, as I said, we have too many hospital beds in the wrong places, partly because the revenue stream for the hospitals is not what it should be. The federal government's not pulling its weight. We have to do what the hospital report says. We have to rationalize care, get hospital beds where they are most needed, take offline hospital beds that are not needed but which cost us a tremendous amount of money, do a better job at providing people who don't have insurance or are underinsured with insurance so that when they go to the hospital, there's actually somebody there to pay the bill.
Well, we know you're going to be working on this.
Yes, it's going to take a great deal of time this year.
This hour's Newsmaker has been New Jersey Assemblyman Dr. Herb Conaway. I'm Joe Basikia for Comcast Newsmakers. The doctor is the head of Health and Senior Services in the State Assembly. Thank you for watching.